Today we'll be going over the talking points of the intake interview with your patient. Make sure you are familiar with the patient's medical history form before you start the interview process with the patient. First, you'll want to start off by reviewing the elements of the medical history with the patient. Start off with the database or identifying data. It's demographic information and it's general information on the patient's name, address, phone number, employer's information, the patient's insurance information, policy number, social security, marital status, gender, and sex. Next is past history. This section will help the physician plan appropriate care. It's allergies, surgeries, hospitalizations, immunizations. It's also where you'll go over current and past medications. Next is review of systems. This is where you ask specific questions about specific systems in the body. By asking direct questions, you will elicit information from the patient that will either forgotten, general, weight loss, weight gain, night sweats, problem sleeping, skin, rashes, sores that don't heal, moles that have changed in shape or color, heat, which is head, eyes, ears, nose, and throat, headaches, eye problems, hearing problems, sinuses or hay fever, sores in the mouth that just won't heal, metabolic or endocrine system, which is high cholesterol, thyroid problems, diabetes, respiratory, which is coughing, wheezing, breathing problems, history of asthma or lung problems. For women, it's the breast, lumps, changes in the nipples, nipple discharge, history or family history of breast cancer, and date of last mammogram. Cardiovascular system, high blood pressure, heart problems, heart attacks, blood clots, leg swelling, GI problems is your appetite, swallowing, heartburn, nausea, vomiting, pain in the abdomen, constipation, diarrhea, history of ulcers, liver problems, hepatitis, or colon problems. For women, again, it's reproductive, irregular menstrual cycles, abnormal vaginal bleeding or discharge, STDs, sexual problems, last pap smear, number of pregnancies, delivery dates, delivery types. For men, it's genital discharge, STDs, sexual problems, prostate problems, and method of contraception. For urology, urinary frequency, history of bladder or kidney infection or kidney stones. For neuro, seizures, strokes, blackouts, depression, anxiety, psychiatric problems in general. For blood, anemia, bleeding problems, blood transfusions, you need the dates of that. Then we move on to family history. Family history contains the health status of immediate family members, parents, grandparents, and siblings, familial or hereditary tendencies, and if an immediate family member is passed away, you need to know the cause of the death. Then we move lastly on to social history. It covers lifestyle, marital status, job, education, hobbies. Also includes diet, sexual history, use of tobacco, alcohol. It helps the physician understand the present illness and possible future illnesses. Also gives a guide to patient education. And then you're not only asking questions, but you're also listening, paying attention to your patient. You're also trying to identify signs and symptoms. Now, the difference between signs and symptoms are signs are objective information that can be perceived by a person. I can see your rash, your bleeding, your coughing, or when I take your vital signs, they're irregular than what they normally should be. Symptoms, on the other hand, are subjective indications that the patient has seen in changes in their body. They complain of leg pain, headaches, nausea, dizziness. The difference between chief complaint and the present illness. Now we're going to take down the chief complaint on the patient's progress report form in the medical record. You're going to try to ask open-ended questions using the patient's own words and quotation marks if you can. Entry will include the date in which the day, the month, the year, and the time of day that you saw them. Then you're looking for the PI or present illness. It includes the chronological order of events. You want to ask open-ended questions to obtain information. How did this first begin? Location, can you explain or show me exactly where the pain is? The severity, describe it. Is it constant? Self-treatment, what medications have you taken for the pain? Over-the-counter, herbal medicine, have they helped? Quality, is there anything that you do that makes the symptoms better or worse? Duration, have you had these symptoms before or have they just started? It's important to know that you should not coax or suggest your questions. They need to be nice and open-ended, because some patients will feel that you're pushing them towards it. So you want to stay nice and open so that they don't answer the way they think you need to be answering. All right, for this part, we are doing temperatures. We're going to go ahead and start with rectal temperature. Use an electronic thermometer. You can use glass, they have in the past, but nowadays it's electronic. They have 2 probes on them, one blue, one red. The red one is for rectal. The blue one is for oral. Don't mess them up. They have a little plastic sheet that goes on them. And then you put lube on a tissue. Rub the tissue on the sheath. When you insert the probe, it's 1.5 inches past the sphincter muscle for an adult. 1 inch for a child and 1/2 inch for an infant. It is 99.6 degrees Fahrenheit is proper temperature for a rectal exam. For an auxiliary, use electronic as well. In the past, they have used glass. Plastic sheath, again. You expose the axilla without exposing too much. So usually they'll have a gown on, and you can have them pull down or take an arm off or something. Or if they have to lift up or something, you'll use a covering. You want to place it deep down and cover, and then it'll beep when it's ready. 97.6 degrees is normal temperature. For an oral, glass in the past, but electronic now. It has probes. If it has 1 probe, it usually has a little sheath right there. If it has 2 probes, remember, blue is oral. This is more important than the last time. Do not mix it up now, right? But it still has a plastic sheath on it. It's under the tongue, either side of the frenulum. 98.6 degrees Fahrenheit is normal. Tympanic is the ear, right? It has a little plastic cover, right? You place it in the ear, right? And because I'm doing it myself, I got to reach around the backside. But if you're just doing it in someone's ear normally, you just reach with your non-dominant hand, straighten out the ear canal so you can slide it in nice and easy with no pain. 98.6 degrees is normal Fahrenheit, of course. Now the temporal artery is for the temporal artery, right? You place the probe on the forehead. You make sure the skin is nice and dry. Then you press it against the forehead. You press the little on button and you hold it or depress it, right? And then you're going to slide it over and down onto the temporal artery. And when you reach that spot, you just let go. Easy peasy. You release the button over the artery, 98.6 degrees. Now moving on to taking a pulse, right? You can carotid, radial, popliteal, posterior tibia, dorsal pedis, femoral, and brachial arteries are all palpitation, or you do it by feel, right? Usually you do it on the radial artery, which is right here. And you take your 3 fingers or your 2 little fingers and you grasp nice and firmly, but gently, right on the inside. You don't want to use your thumb. You can use your thumb on the outside to hold it steady, but you don't want to use your thumb because you have your own pulse, so you'd be counting your own pulse, not theirs. Right? And then you want to take the extremity and you want it to have it resting but supported. That way you can feel it nice and easily. You want to count for 30 seconds and then you times it by 2. If it's an irregular pulse, count for the whole 60. That way you get an accurate description. Now the carotid is right here. You can feel it right neck. The radial we talked about is right here. The brachial is right here. The femoral is on the inside of your thigh, in your groin area. Dorsal pedis is right on here, right on the top of your foot. Like if you look down, you can usually see it doing this thing, right? The posterior tibia, you just position the patient so you can reach right on the inside of their ankle and you can feel it right there. The popliteal is just like the brachial here, but it's behind your knee. And that's all for palpitation. And for auscultation, you use that for the apical, which is under the heart. So if you had a woman or someone with breastises, you have to lift it with the back of your hand, place the stethoscope, which is you have to hear it, and then you listen for the beeps, not feeling for them. You can also use a Doppler device for situations where you're trying to have other people hear it or the room hear it. You get gel on the end, you roll it around, and you wait for hearing the pulse, and then you can hear the pulse. It's basically like, instead of the stethoscope where it's just one person like headphones, it's like a little boom box on the end, so everybody in the room can hear it. Normal pulse rate for adults are 70 to 80, and for the elderly, 55 to 70. Now, checking someone's respiration, you want to do it at the same time as you're doing someone's pulse. You want to stand to the side of them so that you can see their chest. That way when you do the pulse on the radio, you can see the inspiration and the expiration of their breath movements, so that way you can count them. If it is a normal rate, rhythm, and depth, so if you're counting for 30 seconds and the rate is normal, the rhythm is normal, the spacing between the breaths is normal, and it seems like they have an even depth of breathing, you can count for 30 seconds, times it by 2. If it's irregular, be safe, count for 60 seconds, that way you get an accurate number. Now, one respiration is in and out. Inspiration and expiration. Patient breathes in, it's inspiration. The lungs inflate, diaphragm contracts, flattens out, lifting and expanding the rib cage, and that's why you see it fill up. Now, during expiration, the air flows out, diaphragm relaxes, and the rib cage contracts, and that's why you see it come in. If for any reason that you're having problems watching it, you can use a stethoscope. You can use it for the oscillate, and so you can hear it. And then a normal adult's respiration is 12 to 20 per minute.